guys, Lauren and Rebecca here with Bizrok. In this week's video, we want to talk to you about something that is often overlooked, but it's so crazy to me because I'm like, it's so important, right?
It is very important.
And that's about collecting proper data. Now, I know we don't have all day, Rebecca, because we could do a whole training on this, guys, but it's really important. So I want to touch on some of the highlights. Even before we talk about the patient coming into the chair, it started with your morning huddle and seeing what was treatment plan last time, right?
Yes, seeing what was treatment plan last time, cleaning up the charts. I feel like that's always something that's missed, because what happens is you go in to do an exam for the doctor and or hygienist and you're like, oh, did we do that crown on too? Oh, we did, but it's still treatment planned. So it's making sure that we clean up our charts prior to the patients coming in and looking what we have previously done.
I love that, and not to mention your front office team appreciates that so much.
Absolutely, absolutely.
So it's having the idea before you even walk in, and quite frankly, like we said, in the morning huddle. Like those are things to bring up in the morning huddle. You're cleaning up charts, you're taking a look at what was treatment planned last time, what the patient still has outstanding. Now, Rebecca, from a hygienist standpoint or an assistant standpoint, what if they are having a conversation with the patient before the doctor enters the room? Like, what should they be doing?
So the first thing I always make sure I have is an intraoral. So if a patient specifically states, I'm having discomfort on the upper right, take a look, see what's going on. Take your image, take a PA and a bite wing. We already have everything set up. Go ahead and grab both and take an intraoral. Especially if you see something's going on without a patient even asking, I go ahead and take it anyways. The doctor's gonna ask. Save yourself some time for having to get everything back out and take that intraoral film.
I love that, and I think our doctors do too, right? Because it's allowing us to be really proactive, which guys, you know, we've talked about this before. It allows you to become more valuable in your role. Whenever you're trying to think 1 or 2 steps ahead of your doctor, how great is it gonna feel for your doctor to walk in the room and there's already an intraoral and an x-ray up on the screen so that you're like, hey doc, I noticed this and I wanted to have this for you. Now you're able to be proactive for your doctor. Your doctor walks in, greets the patient, and then gets right to work.
Absolutely. And have it up ready to go. Let the patient take a look at it as well. They're going to notice something's off and they're going to start asking questions. And that's what I love. I love being asked questions so that way I'm ready to respond, but I can show them what I'm talking about. They can't see certain areas of their teeth. So when we're actually going over treatment with them, I like to be able to see, do you see this area? Do you see what I'm talking about? And if they can't on the image, you have the intraoral to fall back on. But it's also valuable when submitting any kind of insurance that the patient may have. Go ahead and have that ready. The front office team will greatly, greatly value you for taking that. And they will love you as their new clinician.
Yes, well, and I'm glad that you brought that up, because sometimes on the clinical side, we're just focused on a couple different things like, oh, well, I took an intraoral, but what you may or may not realize is that's not enough information for the insurance company. So unless you have a supporting x-ray, like it doesn't matter. Sure, it helps the patient to actually see it, right? But you still have to have an x-ray. The intraoral is an encouraged additional piece, but it's not the only piece, right?
It's not. And the other thing I think that gets forgotten a lot is an FMX. Whenever you have a new patient come into the practice, or it's been I would say an average of 3 to 5 years, we need to make sure we get a full set of images, not just a pan. And a lot of times we're taking pans because they're a lot quicker. And I do understand that, but you cannot see everything you need to see to diagnose for a full treatment plan off of a pan. There's a lot of burnouts, there's questionable areas. So on average, what happens is the doctor will say, hey, do you mind taking some PAs? And they list 5, 6, or 7 PAs they would like. And instead, just go ahead and take the FMX. It takes 3 to 5 minutes at the most. Take your FMX and have both the pan and the FMX so that you're able to see and diagnose properly.
Love that. Well, guys, thank you so much for your time this morning. As always, we are here to help and support you if you need any help, or if you need some guidance on who you should even reach out to for, okay, I hear you guys, like take intraorals, right? But which company do I use? Reach out to us. We'd be happy to share some different recommended companies. But as always, guys, we can't wait to see you and serve you soon.